One of the common problems that we see for pets presenting here at Illawarra Animal Hospital is dental problems, and that's consistent with our general dog and cat population, with more than 70% of dog and cats having some level of dental problem by the age of 3 years old. So it's a very common problem that we do see. Some of the signs you might see of dental problems for dogs and cats is bad breath. That's a common one that people see, and they don't wish to kiss their dog on their first date. And other times we see gingivitis, so a little bit of pink along the gums, and we can see some evidence of that here in this poster. So we see up here in stage 1 dental disease where we've got a little bit of inflammation of the gums, and basically the plaque is causing inflammation there, and that's the first stage that we have an element of dental disease going on. It gets progressive from there with the ligament around the tooth breaking down, getting pain, the dog only wants to chew, or the cat only wants to chew on one side of its mouth, or it goes off its food entirely. So there's a range of clinical signs that we can see with common dental problems for dogs and cats. Basically, we can help to prevent that through the use of an appropriate diet. So for instance, the Hills TD diet, T for teeth, is a big biscuit which is designed not to be crunched easily and to wear that plaque down. And when you think about it, it's not surprising that dogs and cats have dental problems, because most people don't brush their teeth twice a day. It can be a bit tricky with some dogs and most cats. So it is a good idea if you can use a doggy toothpaste and dental brush in order to remove some of that plaque, but lots of us aren't doing that for a variety of reasons. So they do accumulate plaque, they get the breakdown of the ligament around the tooth, and eventually they need teeth out, or the teeth fall out, or they become abscessed or painful. Sometimes it progresses to the stage where they actually need a dental procedure to be done, and depending on the stage, that can be a stage 1 or stage 4, is going to influence on what needs to be done. But all those procedures are done kindly to the pet under anaesthetic. So we put them on intravenous fluids, we give them some sedation and some pain relief, we anaesthetise them, we take some x-rays, and just as shown in the picture here, that can result in the recession of the gum line and the exposure of the roots, and that gives us an idea which teeth are healthy and which need to be removed. If there's no teeth to be removed, we can scale all the plaque off the teeth, and the gingivitis will settle down as a result of that plaque being removed. And we can also then polish them up. So we use a polish in order to stop the adherence of plaque ongoing. It is important to maintain the teeth after that with some dental chews. So some Orovet chews are recommended here at Illawarra Animal Hospital, or an appropriate diet such as Hills TD. If there are teeth to come out, we use local anaesthetics as well as the general anaesthetic that we're under. We use extra pain relief. We give them an injection of antibiotics, so you're not having to dose them via tablets into the mouth at home, particularly after they've had teeth out. That can be tricky. And we send them home with some pain relief for home as well. So all those things happen after we've taken the x-rays and we've assessed which teeth, if any, need to come out. In dogs and cats, we have multi-rooted teeth. So most of the molars and the premolars have got 2 or 3 roots, and that makes them tricky to remove. Also, compared to us, they have very long roots relative to the crown. So all that means that we section the teeth. So we actually cut them into parts and remove them accordingly, and that works really, really nicely and makes it much kinder for the patient. So once that's all done, we might suture up the gum line in order for things to be not to get stuck in there, or the socket not to dry out. And then we get them back a week later just to check out how everything's doing, and we go from there. So we really enjoy our dental work here at Illawarra Animal Hospital, and there's a lot in it, but we love doing it, and yell out if we can be of any assistance.